Welcome to Unit 4, Lesson 1 of Principles of Health Science. Today we're looking at personal qualities of a healthcare worker. So what is a personal quality? Well, personal qualities are personal characteristics and your appearance and how you handle things. So first, let's look at some good characteristics that a healthcare worker should have. Now, this guy's name, let's name him, his name is Bob. Okay, I'm not going to write his name, but let's say his Bob. Now, Bob is a healthcare student, and you can see he's in his hospital uniform. So imagine Bob is part of your class for today. What is a good characteristic for Bob to have? Well, he should have empathy as a healthcare worker. And now, what is the difference between empathy and sympathy? You should know this. So I'm going to write sympathy. Sympathy is when you feel pity for someone. So you're going to say that, oh my gosh, that's terrible. I feel so bad for them. That's pity. Now, empathy is going to be, I feel their pain. I'm going to sit with them. I'm going to help them. So Bob is going to say, I hear you. Now that says a lot about Bob being empathetic. And now Bob is going to be honest. Bob is going to say that when I make a mistake, it's my fault. Or he's going to be honest and say, I don't know. If he doesn't know, he's not going to lie to a patient. That is honesty. And then he's going to be dependable. So how can Bob be dependable? Well, Bob is going to wear a watch to make sure that he's always on time. So on time. Being dependable is when you are prompt and you perform jobs accurately. Now, honesty is truthfulness and integrity, and empathy is being able to identify with and understand a person's feelings, situations, and motives. So you're not going to say, I feel bad for them. No, you're going to sit with them if they're upset, and you're going to be able to put yourself in their shoes. Okay, and then Bob is going to be constantly willing to learn. That's a good quality of a healthcare worker. So he has a pen because he's always going to learn. Willing to learn, that growth mindset. Which means he can adapt to changes, adapt to being wrong. And then he's going to be patient. He's going to be tolerant and understanding and control his temper. So he's always going to be smiling with his mouth because he is patient. And that means that he is tolerant. Now, should you always be smiling? No. If somebody's upset, don't smile at them. But Bob is going to be tolerant and accepting and control his personal temper to make sure he can give his best self for his patients. And then he's going to accept criticism and learn from criticism. So Bob is going to carry a second pen that allows him to take notes and learn from criticism. And then he is going to be enthusiastic. So not only is he tolerant, but he's always smiling, which makes him enthusiastic. He's going to have a positive attitude. So he's going to be positive. Let's draw a plus sign. Okay. And then there's going to be self-motivation and the ability to begin and follow through with a task and place yourself in unsafe situations. So he's not going to risk his life because that's weird, but he should be able to be motivated and do things that he usually might not do. And so we can represent that with his, let's say he has a pocket, and Bob's pockets are filled with stickers. Let's say he has a sticker. Okay, Bob's pocket being filled with stickers is going to motivate him because he wants to motivate his patients to do things. So he's going to give all his pediatric patients stickers when they listen to him, and he's going to put himself in a situation where he is giving people stickers and brightening their day, and he has this thing inside him where maybe he doesn't want to give these pediatric patients a hard time, so he's helping them. So that is willingness to begin / follow through. Is being persistent because all his patients keep running away. Maybe he's a pediatric nurse or something. And then he's also going to be tact and having the ability to do or say the kindest or most fitting thing in difficult situations. So he is going to be patient, he's going to be enthusiastic, and he's also going to be tactful. And tact means that you do the kindest thing even in the hardest situation. So you don't judge, you don't be mean. Kind in hard places. Hard. Okay, and then there's going to be competence, and he's qualified and capable of performing tasks. So how does he show this? Well, he's going to wear his ID, like all of you should. And he's going to say that I am a nurse, or I am whatever. Even if he's a student, he's going to show his competence. Now, that doesn't mean, this is just symbolic representation, but competence also means if you don't know how to do something, accept that you don't know how to do it and learn, but make sure you are able to give your best care to your patients, right? It's always about quality of care. So he has competence. And then he has responsibility or willingness to be held accountable for his actions. So that's what he's going to put. He has a phone in his pocket, for example. His phone is going to give him the ability to do a lot of things. But it also has his calendar or something in it. So he is able to be held accountable for his actions. He is a responsible person. And he can be held responsible or held accountable. And then discretion, which is good use of judgment in what you do and say. So what is a good use of judgment? Well, let's draw him a brain. And his brain has all the things a brain has, and he's going to use his discretion. To do things for his patients. So discretion means to use best judgment. Okay, so those are personal characteristics. Now, what are some things about your personal appearance? Let's draw another Bob. Okay, so let me move the frame for drawing a second Bob. Now, this Bob is going to be a female Bob, so let's name her a different name. This is going to be, what's a good female name? This is going to be Betty. Betty has a very clean, neat uniform. So let's draw her a very well kept, neat uniform. Betty says no wrinkles in sight. Uniform is clean. Okay? Let's draw Betty a face too, because we forgot. Betty has beautiful eyes, blue eyes, and she has lipstick on, and she's smiling. Oh my gosh. Okay. Betty is so pretty. Okay. Now clothing should be clean, neat, functional, and in good shape. We forgot to give her pants. This is also free of wrinkles. These are her pants. And then she has a name badge at all times, or her ID card. So this is going to be her ID card, and it's going to have her face on it, with no stickers on it, because we have to be able to identify her. So she's wearing her ID badge at all times. And she has well-fitted, good shoes. Now her shoes are going to be leather shoes, because that's what you'll need when you go to the hospital in a few years. So she has shoes that are good, well-fitted, and amazing. So good support. And then personal hygiene. So Betty, as you can tell, is super clean, and Betty showers daily, uses deodorant, and has good oral hygiene. So Betty is smelling amazing. Now, Betty doesn't wear a ton of perfume, because that's really gross, and nobody wants to sit next to you if you smell super strong. So no perfume. Betty says, ew, I don't wear perfume. But she is super clean. Okay, she maintains good hygiene. And we can represent that with some stars for her. And then there's gonna be your nails. Now, short, clean, no polish, use lotion, no artificial nails. Now, the no polish thing, that's not part of your clinical's dress code. You can have polish on as long as it is without glitter. So these notes are kind of weird, but it says no polish. So let's draw some polish so we can cross out this hand and say this is wrong. And then it's going to have a huge artificial nail. This is not Betty's hand, because Betty would not do this. And then she has shimmering on it. Okay, absolutely not. No polish. Short. And no artificial. So especially not acrylics and stuff, because that can react with things and we don't want that. And then there's going to be hair. So there's no extreme hair accessories, and she's going to pull her hair back if she has long hair. Now Betty has short hair, so she's not going to pull it back. But let's draw her a ponytail over here just to be, so we can label it. Long hair pulled back. Now, according to your dress code in Tomball ISD, you can't have hair in your face. So don't have, a low taper fade in your eyes, because nobody can look at you then. And then jewelry, only wear a watch, flat wedding band, and small pierced ears. So she's going to have a watch on so she can get the patient's pulse. And she's going to have earrings because Betty is aesthetic. And then she's going to have a flat wedding band, which is the one thing that this image is doing right. But you wouldn't have a wedding band anyway. Now, if you have a giant wedding ring and it is like a diamond, then if you put it in gloves, it can rip the glove. You can get it lost in a patient or anywhere. It can harbor bacteria. It can scratch a patient, and you don't want that. And then for makeup, you don't want excessive makeup. You can create a natural appearance instead. So Betty is doing great. Betty looks great. So let's use her as an example. And then there are things for good health that we didn't cover, but good health is basically diet. But that is all of Unit 4, actually, personal qualities of a healthcare worker.